75-year-old female. Some fecal mucus is noted in this picture. A Japanese woman who has been suffering from chronic constipation for many years. Her diet consists heavily of a Western-type menu, including white bread, yogurt, cheese, fruits, and cake once a day. She consumes 3 to 4 cups of coffee and tea a day. There was insufficient daily intake of water. She has been on various kinds of laxative every day, including Seneca, aloe, and other herbal medications for years. There are marked pigmentation and spasm. 45-year-old female with breast cancer. 6 months prior to this exam, she had a lumpectomy and radiation treatment. There are marked fecal retention in this picture. This patient has been suffering from prostatic CA, high blood pressure, and high cholesterol. His diet consists of high protein, red meat, and dairy products every day. His colon shows narrowing and some diverticular disease and fecal retention in each segment of the colon. This 65-year-old female with chronic constipation had breast cancer surgery and was referred for colonoscopy. Examination showed marked stool retention in many areas of the colon despite 2 days of preparation.
Hello. Can everyone hear me?
Yes, we can.
Okay, amazing. Good afternoon, everyone. How's
Afternoon.
everybody doing today?
Good, how are you?
Good. I'm super excited about this session. Can't wait to get started. I know you guys have heard the saying, you are what you eat. I think it's extremely important. It's a privilege to have Dr. Rofeh with us again. So I'm going to let him take the lead. I have his presentation here, so I'm just going to get started. He can introduce himself a bit more. For those of you that are joining us for the first time, we are Pamoja's vision. So I'm just going to mute everyone. Pamoja's vision is to build on the legacy of our ancestors by leveraging the power of group economics to build generational wealth within our community. And in 2002, a group of us, about 30 of us, came together and we purchased 100 acres of organic arable farmland in Cowata Lakes, Ontario. And we're just getting started. It's just the beginning, of greater things to come. We're still working together to build our organic farm in Cowata Lakes in Canada, which is approximately about an hour, 15 minutes from Toronto. So greater things to come from our organization. So Pamoja is doing big things, and This year, we're planning to purchase greenhouses so we can grow all year round, even in winter months. Okay, so that is what Pamoja is all about. We're all about community empowerment and growing together economically and building our own generational wealth. Without further ado, I'm going to let Mr. Dr. Rofeh take over. So, Doctor, I'm going to present for you. Can you see the slides?
Yes.
Okay, amazing. So I'll just start presenting.
Can you hear me?
Yes, we can hear you.
Awesome. I'm excited. Today is smooth. Okay. So welcome everyone to today's session. Do we have some new faces on the call today that weren't part of the initial or previous meeting?
Absolutely.
Yeah, I wasn't there.
Or everyone here so far is...
Well, we have some new
Okay.
faces. Yeah.
Yes.
Great. Amazing. So I'm going to kind of pick this again, and today, having much ample time, I'm going to take my time to, make sure we all get it. And today our video is playing, so fantastic. So my name is Rofeh Emmanuel, and I'm a naturopathic physician and a gut specialist at Gut Care Regenerative Health Center at Accra, Adenta, Ghana. And I also have a foundation that kind of see to it that we free gut health education to our people, because I found out the missing link in our health being vibrant as we wish it to be is our lack of awareness on gut health. And we see in the world today, almost all the top physicians are moving towards gut health, gut health, gut health. And it makes sense when you put it all together. And I want the family on the call today to kind of see the reason why gut health is indeed the key to overall health. So my brother Busari, we can actually move forward and move on to the next slide.
Okay.
So this is our center in Accra, where we have a lot going on, having colon hydrotherapy, kind of, natural bathing of the colon with filtered warm water. We have therapies such as massage therapy, reflexology. We have, regenerative nutritional sessions. We do have plant-based vegan catering services, as well as cooking classes to re-educate our people on how to cook for nourishment and not cook just to satisfy the taste buds. There's a lot that goes on or goes through here in this facility. So, to know more, you could visit our website and, learn more about what we're about. We could move forward. And here is our mission and vision. Our vision basically is to, we focus on all-round holistic health, self-care. And our main goal is to re-educate. And this is what we have a legit NGO going about, stressing on gut health education throughout institutions, churches, schools, whichever group that invite us. And this is free of charge. We do not charge anyone. Free of charge, we get invited to any group that is above 10, and we educate, enlighten, re-educate ourselves on gut health. That's what we do. So in all my presentations, before I start, I kind of take us backward to understand the human development, okay, and the skin layers. How in our body, everything goes back to an ancestral skin layer. So we understand how keeping one tissue under stress, automatically you get to share the stress with other tissues. So there is nothing like you have high blood pressure and you are working on getting your high blood pressure subside, and your attention is on the vascular system, the cardiovascular system, on heart and the vessels. That's not enough, because you have to go beyond just the heart. If you have high blood pressure, you have to go beyond just the pancreas. If you're having insulin disorders, you can't stand on organ to try to solve a disorder that is coming away from DNA or organelle or cellular level. That's something I make sure my viewers understand, how to properly regenerate, because you are coming from an ancestral line with your makeup. You're not just you that you see. So over here, I have a note there which help us to understand the various skin layers that actually birth the various tissues that could be found in our bodies, like the mesoderm, that birth the pineal gland, the brain, the spinal cord, the heart muscle, sex organs, the kidneys, the bones, the lymph. So these, on the left side of the screen, you get to learn how to make sure these skin layers are resolved at cellular level, and not just picking a bladder to medicate, or just picking kidneys to medicate. It doesn't work like that. And we find in our society, no one has been able to solve no health issues by tackling it singularly or individually. You have to view it, you have to go beyond that. So that is enough, and we could move forward, because this is just to plant a seed. And we move to self-awareness. Self-awareness is equal to self-love, okay? And if you are not aware of yourself, there is no way you could give love to yourself. And how do we know someone has self-love for him or herself? It comes from self-identity. You first have to identify yourself before you could love yourself. So, for instance, if you forget to acknowledge that you as self, as you are, you exchange materials with your surroundings, such as gas, water, waste, and what have you. You could find yourself comfortably inhaling toxic substances to go in to contaminate your blood, and you're going to be okay with it, because you lack knowledge of self. So this on the screen is also there to plant seed in us, so that we could become aware of ourselves, because the entire human body is miniature of cells. The entire human body is miniature of cells. So if you don't become aware of yourself, you're going to lose it. And some of the points that we could see on the screen. For time's sake, we're going to move forward from this slide and get to what the gut is, the human gut. Now, do we have anyone on the call that doesn't know what the gut is? In other words, can I get more than half of the family on here to raise their hands to, tell us what they know about the gut, the human gut, kindly. What comes to mind when you think of the human gut? What do you think was the gut?
Stomach.
Stomach, okay. What else?
The large bowel.
The large bowel. What else?
What do anybody know about the stomach?
Did we get another point on stomach?
Yes.
Apologies, what was the question again, please?
What comes to mind when we hear the word gut? Gut. What comes to mind when we hear the word gut? What do you know in your understanding? What do you know the gut to be?
Instincts.
Instincts. That's a high point.
Like it's your second brain.
I was gonna say
Second
that.
brain.
Yes, sir.
I was gonna say that.
Awesome.
Wow, that's deep.
That's deep for real. Well, that's good. Everybody that says something is on point, and absolutely right. Our gut actually entails all that we have said. And we're going to get deeper into it so we have a clearer picture of what the gut is the next time we hear of the gut. All right? Someone has raised the hands. Mr. Rogers.
Yes. I have a question. First-hand experience, being in the military and combat, and then also reading various books. Soldiers that are in combat and their stomach, they're under extreme tension and that heightened awareness for too long. The stomach, I guess, tightens up. A lot of soldiers in the past used to die from it because they didn't know how to treat it. In the Oriental and the ancients, they say there's a certain type of massage or some kind of way you have to work the gut. Otherwise, if it stays that way, that person is going to die. And I'm definitely curious about that.
That's a high point, and that is part of the stuff we're going to get into. Some of these knowledge are clinical facts that I've gathered so far in my course of 15 years of practice. Some of the things you can't read from the books, you can't read from the internet. Physicians like us on the ground practicing, handling bowel disorders have enough to share that is not in the books. So I'm glad you brought your testimony, as you said, witness disorder, someone personally went through. Because what we're going to discuss here is very risky, very deadly, and we have very little information about it getting out there. So let's get into it. We are looking at our gut. Okay, we are looking at the human gut, and what we have on here, okay, a little background history. How many of us know, besides, this moment that I'm going to share, that the part of the human tissues, part of the tissues that forms in embryo stage of the human body. Actually, we have the ass hole, we call it, which we call also anus, that is to be the part of the first tissue, hollow tissue that forms right there in the stages of the embryo stage, in the baby formation, fetus formation in the mother's womb. How many of us have heard that we are first an anus before any other tissues? How many have heard this? Is this the first time?
Yes.
Okay.
Yes.
Let me tell you more. So we're looking at the digestive system, and interestingly, the science is showing us that the alimentary canal that we see today, which if many of us are the alimentary canal that we see today, that if many of us are being questioned, can everyone hear me? Can everyone hear me?
Yes, we
Yeah,
can hear
we
you.
hear you.
We can
Okay.
hear you.
Can everyone else mute your mics, please?
Yes.
So the
Other people's mics are on, so it's disturbing.
the alimentary canal that we see today, that if most of us are being questioned how we start, most of us will say it starts from the mouth and it goes down just as the process of digestion goes. Most of us would think it starts from the mouth. But interestingly, it starts from anus and closes up in the mouth. The digestive system we know today, it starts off from the anus. Let me see if I could help us. So if we could see it, it starts off as anus. It starts off as anus and closes up in the mouth. This is how our digestive system is formed. Did we all catch that?
Yes.
Yes.
Did we all catch that? Okay. So moving forward, we see as I move forward, I'm taking it slow, step at a time today. No rush. So as we move forward, you're going to understand why the gut contains so much power and has a lot of impact over our entire body and health.
From the farm,
Okay, so what is on the screen? We are viewing the human gut. Now, our colon, or the large bowel, is in length about 6 feet long and about 2 to 3 inches in diameter. I'm still on the large bowel. Our large bowel, which we call the colon, can expand 10 times its regular size to contain what we can't eliminate or anything that is obstructive. It's first a muscle that could adapt to whatever weight or expand to whatever size, provided whatever in it keeps expanding, it's also going to expand to contain it. So that is the anatomical view or properties of our bowels, especially the large bowel. Now, the small bowel, or what we call the small intestines, is also about 24 feet. And if we are putting the small bowels together with the large bowels, we are looking at about 30 feet long hollow tube that nature had folded nicely in our abdominal cavity. Oftentimes, we also refer to as about 12 times our body length. Your height, about 12 times your height, is the length of your bowels. And we have different types of gastrointestinal tract, or we have different types of digestive tract or systems. And in comparison, we see that the anatomical and physiological character of humans, for a fact, ours falls on a fruitarian kind of digestive tract, meaning a digestive tract that scientifically proven it is designed, if not for any crisis and if not for any issues at all that would cause you to have to adapt to certain foods that you would eat for survival. If we're talking about eating to thrive and to live on, the perfect food for this gastrointestinal tract is fruit. That's what the science has proven so far, that our bowels can deal with without any side effect. Now, we move forward, right? And we compare our gut to other things such as tree, and our gut in comparison can stand in for the roots of the tree. Our gut could be compared to a root of a tree and could also be compared to injectors of a car. Okay, injectors of a car, and we could move forward from here because it's self-explanatory. In this video is just a clip showing how tree goes through a process of absorbing moisture from the atmosphere. So we could skip that. Okay, so we move again and we're going to look at the gut. Is still, we are comparing the gut, or we are looking into it as what it really is. And we see that because, now pay attention to what I said earlier. I said our gut is one of the first hollow tissue to form, to birth other tissues. Therefore, nature, and in the process of formation, a lot has been given to it. If you're comparing, it's like if you're comparing the human body to a house, our gut stands as foundation of the house. So if you're building a story building, your iron rods and all your different things that you have to lay in the foundation and build on top of, that is what we see our gut possess. So there are neurons in our gut than we have in the spinal cord and the brain that we've known as brain all these years. There are neurons in our gut than there are in the spinal cord and the brain. We see there are lots of arteries. There are a whole wide of arterial supply in our gut that your gut can put you to sleep depending on what you eat. It could demand a serious blood supply for digestion or elimination that you could literally feel sleepy over some kind of heavy food that you eat or hard to digest food that you eat. Your gut demanding enough blood supply could put you to sleep for proper digestion. We see the immune system could be found in the gut, as we have capillaries laid in the gut, and is the entrance to our immune system, which in a proper term, we could look at it as the lymphatic system. Our gut is open into these different systems, and the entire body is dependent on it. We see the gut as a mother brain. We see the microbiota affect and have influence on the upper brain in terms of neurotransmitters, influence on stress, anxiety, mood, behavior. So a lot of people, you know, and we have this, sisters could perfectly help us to understand, you know, when stuff are going on in the abdominal area and it affects them mentally. We see the brain in the scalp affecting or having influence on motility of the gut bacteria, secretion, nutrient delivery, and microbial balance. The balance of our bacteria. The upper brain also affected. So this is what brings about the gut-brain barrier, okay? That I believe a lot of us have heard about it, the gut-brain axis. So we could move forward from here. We've seen what the gut is. It's more than a channel for poop and a channel for food. Today, we have come to know a lot about the gut. We also know it to be the habitat for the human microbiome, which I've said some already. So the gut have influence on the disease that you suffer from. It has influence on your physiology, as we know that, you know, today there is difference between children that are birthed through cesarean, you know, their exposure to gut microbiome, their gut microbiome is not as healthy and is not as active as compared to the children that were delivered through cesarean. We know gut microbiome have influence on our growth, influence on our nutrition. So we know today you don't just eat some well-labeled food and imagine or think you're going to get what's on the label into your body. The food must be in alignment with the natural order. Else, we know today your gut microbiome, if they fail to break it down, you will not be able to get nothing good out of what you eat. The brain, the gut as a reflex organ. So the gut as a reflex organ, we're looking at the colon being connected to every other tissue. I mentioned this from the beginning, that you could have issues in anywhere in your colon, and it's going to reflect to these various areas that we see on the chart. So a lot of us that have the transverse part of the colon where the brain is, which a lot of blockages happens in this section. A lot of blockages, you know, happens on the transverse side of the colon. It looks like a bridge that we walk on or drive on. And because these areas has a bend, you see, there is a bend towards your spleen area, you know, and there is a bend towards your liver area, which we call the bend at the liver side and the bend at the spleen side. These bends makes it very easy for fecal stool to get blocked in the transverse regions, okay? And a lot of times when these areas are blocked, we begin to feel foggy in our brain and we begin to develop sinus disorders. And it's just that simple. If you come towards the rectum sigmoid region, a lot of us that have tightness in our legs, you know, tightness having kidney disorder, stresses on the kidneys. A lot of time clinically, we improve people with these conditions and they have impaction, blockages in their rectum to sigmoid region, leg pain, leg discoloration, and what have you. That is originating from fecal impaction. And they had no idea that all this burden that they've been taking medications for and seeing no improvement could be resolved right from their colon. They were amazed. So literally, for everywhere you see on the chart, you could bruise anywhere in your colon and have it correspond to another tissue that actually shares a nerve, shares an artery, shares a capillary from right here from your colon. We know infertility is a gut or bowel disorder where your bowels, especially your colon, being connected to everywhere, start to feed your reproductive organs junk, begin to feed them the toxins that you can't move out naturally on your WC. We call it auto-intoxication, which is self-poisoning. And it's real, family. It's so real. You could waste money on a lot of pills, vitamins, supplements, and not get the benefit of your money because you are blocked, you are sluggish. And until you move out the sluggishness, you're not getting anywhere with that investment in vitamins. So now let's get into how do we stress our gut? Something we need to pay attention to. My most concern. Let's move forward. And before we get into it, let's watch how digestion works.
Digestion is the process of breaking food down so that nutrients can be absorbed by cells. In your stomach, food is churned and mixed with acid and enzymes. It is then pushed into the first part of the small intestine where most digestion and absorption takes place. To aid absorption, it is mixed with bile, which is produced by the liver and discharged from the gallbladder through ducts. Digested food molecules pass into blood vessels in the walls of the intestine and are carried up through the portal vein into the liver for further processing and storage. The liver is usually a rich red color, but excess lipids stored in its cells can change it to a whitish color. This is known as fatty liver disease. It is closely associated with obesity, particularly central obesity, involving the omentum, a fatty pad that hangs down from the stomach. Eating too much fat can cause it to push out, producing a large waistline. In some people, eating certain foods can irritate the walls of the small intestine and disrupt regular movement, resulting in altered bowel habits or irritable bowel. Almost all nutrients have been absorbed by the time digested food leaves the small intestine and enters the colon, where water and salt are extracted, leaving solid wastes for elimination.
Okay, we heard it. Now, to throw something in, the fatty part that hangs out, that is a disorder when you begin to develop liver stress. When your liver is beginning to give up on you, that is when you begin to develop that kind of fatty part that hangs on your belly. So we have a whole lot of other lecture on different bodies, different tissues and how they communicate their stress. Today we're looking at how our gut communicates its stresses to us. From what we just watched, we come to this chart here, which helps us to understand what we were designed to eat or what we were designed to nourish our tissues with. Is it what we have today? Certainly no. As when we discuss the food we're eating today, we don't even have our list on here. because we have actually developed a new method, a new style of eating. But the science is saying that by comparison, we are very similar to the frugivore, the creature that eats water, not drinks water. This creature eats water. And the similarities in us, you find out that most of humans could hardly consciously love water. You know, we drink it, we have to key into our mind, conscious level, some reasons to drink water. And even that is hard to pick water about more than 4 liters a day. Many goes throughout the day with only 500 milliliter. Most go throughout the day with just a liter. It's hard for us to drink water like that because, I mean, we are not the creature that is supposed to be on water. Herbivores are the water creatures. They eat dry stuff and they're supposed to heavily be drinking water to facilitate easy digestion. But we are anatomically frugivores designed to eat water. And for that matter, it doesn't occur to us to drink water like that. That is why everywhere you turn, humans don't like drinking water, except their physicians have asked them to, or they are in some crisis and they need to stay consciously on water. So how do we improve on that? That's a question to all of us. But on this chart, we find out that we belong to the mammals with long intestinal tract, about 12 times our body length. And on top of that, the points are many. If we could all see the screen, we could actually take a screenshot and read the details. But my point is, we have the type of intestinal tract that only moves when it senses fiber in our oral cavity. You know, it moves the rest of the intestinal tract, prepares them for movement, you know, when we have fiber in what we are chewing. So the question is, what happens if we don't have fiber to what we are chewing? How does this oral cavity, intelligent as it is, how does it take what doesn't have fiber? If the science says requires fiber to stimulate peristalsis, then today we found out that our oral cavity is picking on the food that doesn't have fiber as a threat, just as the nasal cavity picks dust trying to get into the lungs as a threat. And we see immune response called on to attack the dust. And in few hours, we catch cold. And the same thing happens in the oral cavity when we have the heavy fried stuff in our mouth. Because oil doesn't have fiber, the fried food is picked as a threat. And you begin to cause this alimentary canal or the GI tract to attack what you have in your mouth chewing as a threat. Begin to secrete excess mucus to engulf it and to see it through the alimentary canal. Now, what we see is that alimentary canal didn't move what we chew that doesn't have fiber by itself, but it was sensed as a threat and immune response was called onto it, and that food gets into us through excess mucus. We have 2 types of mucus that gets secreted over what we eat. We have this clear mucus that we normally see when we are brushing our teeth. That's the safer one that, you know, little movement of the bowels or the alimentary canal, a little movement with that type of mucus, you get whatever you've eaten, such as watermelon, fruit, or veggies. They don't get to have no thick mucus secreted to see them through. Movement of the bowels with that clear, slimy mucus is enough. But if you have a burger with processed flour, with other things that doesn't go together in your mouth, your oral cavity senses it as a threat and attacks it. And in the end, we will get to see how it looks when our GI system attacks what we eat. We're going to see how it looks. So over here, if I have to say something else as planting seed, we know that the carnivores have fat receptors. They have fat receptors, and this is why they taste their flesh raw. And we see that humans have salt and sugar receptors, and this is why we can't eat the flesh, animal flesh, the meat raw. We need to season it up to meet our taste bud, because our taste bud is salt and sugar. The typical carnivore taste bud is fat receptors, so they can taste fat. We can't taste fat in its raw state. We need to spice it up. So these 2 points. Another point is our stomach acid is very weaker compared to the typical carnivore stomach acid. They are not even designed to chew, designed to swallow. We are designed to chew because our food has to be ready in our mouth. Just as we all know from basic science, digestion of carbohydrate begins in the mouth. So we have glands in our mouth, our saliva is alkaline and their saliva is acid. So there's a lot of differences that the science and the fact coming out showing us why we have certain digestive disorders and these mammals doesn't. It is because these mammals stay in their lane and we don't stay in our lane. Next slide.
The final stages of food digestion take place in the large intestine, or colon. After nourishment is extracted from what we eat, the leftover waste material mixed with water flows from the small intestine into the colon. After entering the colon,
so
stool
you can pause,
as it travels
kindly
upwards.
pause this for me. Okay, so we also, on this slide, we get to clear the superficial understanding we had about what constipation was. Okay, for a very long time, we've been carried on with the impression that we are constipated when we go for about 3 days or more without passing a stool. We thought that is what constipation looks like. But the science is showing us that constipation, which is coming from the root word, of a Latin word, when you break it down, it means to crowd together. Constipation means to crowd together. Now, we see from the root word understanding of constipation and the science is showing us that if we are eating 2 to 3 meals a day or more, our bowel movement as passing stool should be equal to the same amount of plate we eat daily. And in this slide, we're going to understand why our bowel movement or stool passing is happening to be once every other day or once a day when we eat or ingest 2 different types of meals a day, or we take in about 3 to 4 different types of meal daily, but we only eliminate once a day. We don't see that on the baby. You feed the baby, in few hours, they poop on themselves. What has happened that we've all been babies before, and now we don't get to poop as we used to be when we were babies. We could go 2 days, 3 days, or we could go 2 to 3 different kinds of meals a day, and we could only pass once a day or once the next day. It's not normal. for the past or for a long time ago, we've thought it's normal to go through the day with 2 to 3 meals in your system, and you've only gotten the chance to eliminate one of them. Where are the other plates of meals hiding at? Today we
Stages of
know
food
the proper definition of constipation. Let's watch it.
The final stages of food digestion take place in the large intestine, or colon. After nourishment is extracted from what we eat, the leftover waste material mixed with water flows from the small intestine into the colon. After entering the colon, stool loses water as it travels upward through the ascending colon and across the belly through the transverse colon. As water is lost, stool returns from a liquid into a solid as it goes down toward the rectum in the descending colon. Stool is moved through the sections of the colon by waves of squeezing muscles in an action called peristalsis. Constipation can occur if too much water is absorbed from the stool or if peristalsis is slowed down. Many other factors can also play a role, such as a poor diet low in fiber, emotional stress, or other medical conditions.
So that's it. So for that fact, we have a lot of us walking around with fecal impaction, or we call it fecal retention. There's a lot of us walking around with poop in our colon weighing about 15 to 20 pounds. And it's contributing to our weight. And we've seen the point. Food lacking fiber, emotional stress, all of these. If the last thing to look at is the medical conditions or the medication that we take today that affect us, from our bowel level, we see all these disorders starting from a stool retention, okay? All these different issues that we have is starting from or beginning from stool retention. Now, from here, before we move to the next slide, I explain this to us. In our bodies, there is 4 activities going on in our bodies, which is ingestion, that is taking in the food, digestion, okay? That is what you've taken in is being processed. We have absorption, assimilation, what you've taken in that has been disintegrated or digested, whatever good in what you consume is being absorbed and assimilated into you, and whatever that's not needed supposed to come out, which is the elimination. If any of these is impaired, you're going to be in trouble. And I want you to understand that forget whatever the label medically that you've been given, that you have diabetes or you have sinus problem, you have whatever the medical label that is given to you. Your problems are being birthed or originating from impairment of these activities. These 4 activities that I've explained. Your body's breakdown begins from there. You make sure your ingestion is correct, absorption is correct, elimination is on point, then you'll be good to go. Now, this right here is clarifying constipation that is misunderstood through miseducation, showing us how the different intestinal looks actually correspond to the health crisis that we suffer today. In other words, we are the direct reflection of our bowel health. We are the direct reflection of our bowel health. Let's have a look.
75-year-old female. Some fecal mucus is noted in this picture. A Japanese woman who has been suffering from chronic constipation for many years. Her diet consists heavily of a Western type menu, including white bread, yogurt, cheese, fruits, and cake once a day. She consumes 3 to 4 cups of coffee and tea a day. There was insufficient daily intake of water. She has been on various kinds of laxative every day, including Seneca, aloe, and other herbal medications for years. There are marked pigmentation and spasm. A 45-year-old female with breast cancer. 6 months prior to this exam, she had a lumpectomy and radiation treatment. There are marked fecal retention in this picture. This patient has been suffering from prostatic CA, high blood pressure, and high cholesterol. His diet consists of high protein, red meat, and dairy products every day. His colon shows narrowing and some diverticular disease and fecal retention in each segment of the colon. This 65-year-old female with chronic constipation had breast cancer surgery and was referred for colonoscopy. Examinations showed marked stool retention in many areas of the colon despite 2 days of preparation.
So,
Wow, sir. After watching that video, I don't want to eat anymore. I don't want to eat anymore.
so, as I said, it's only when you are on the field helping people that you could come out and clarify some of the misconception, because I have heard lots of physicians that are, gastroenterologists, a lot of them talking about you don't need colon hydrotherapy because your colon takes care of itself. It eliminates stuff and you don't need no external nothing. But what is the science saying? The science is showing us that if you're having cooked meal going into you 2 to 3 times and more daily, which most of them doesn't have fiber, there is no way you could poop that food, the final waste of it, out of your colon. There is no way you could eliminate that sitting on your WC. It won't come, no matter how you try. So we saw the waste that could accumulate in the bowels and how the colon hydrotherapy helps in evacuating this waste out of our bowels. It's so important, family, because our colon is not just some inanimate object we could bruise anyhow and it still be colon. It does go through deformities, as this slide on the screen. We have
Hello, doctor. Can you unmute yourself?
Yes.
Oh yeah, we can hear you now.
Okay. So I was saying that the colon does go through deformities as we walk around with these impaction, these stool retentions in them. And I will bring this to our attention. Basic science of matter, okay? And we learned that matter in solid state.
Sneakers on. Are we on? Sneakers on.
We learn in the basic school that matter, comes in the shapes of solid, liquid, and gaseous. And we see our colon doing a job as a brain, not just any brain, but mother brain, because it houses triple the neurons that could be found in our spinal cord and in the brain in our scalp. Now, our colon is capable of converting solid waste that we can't or fails to eliminate. Our colon is capable of converting it into liquid. And here we have our diarrheas from. It's capable of converting solid that can't be eliminated into gaseous. And here we have passing of air or gas through our anus or through burping. It tries to get content in its chambers out of it in any way it could. But since we are caught up in a lifestyle, it's never successful. It's never able to carry these activities successfully before we drop more stress on it. So we see conditions such as the transverse part of the colon becoming too heavy with fecal retention or fecal matter. It gets too heavy and it drops in. We call it prolapse. And oftentimes when it drops in like that, it drops on reproductive organs, especially for sisters.
I'm going to give you just 4:20.
Especially for sisters, prolapse colon, the transverse colon can drop in and put pressure on your fallopian tubes, which a lot of times, meeting, having sexual activities could result in your partner's fluid getting right back out when the activity is over. You could have the transverse part of your bowel just dropped in like a broken bridge over your reproductive organs. And we have spasm, where any part of your colon as a muscle can close in on itself, become very narrow in some areas that your fecal matter to pass through that area has to stay back for days and resize itself to be able to pass through those areas. And people who suffer this experience pencil stools. Their stools come in a form of pencil, like even their children's size of stool is bigger than theirs. We have balloon sigmoid, where your sigmoid region could balloon out like a blown balloon. And with every part that gets deformed, mind you that on the previous slide, I showed us how the bowel is connected to different tissues. So any part that gets deformed goes down with the corresponding area, or the areas that actually shares nerves, capillaries, and what have you, arteries, with that particular area going down, getting deformed. You're going to have that shared with the corresponding tissues. We have stricture, areas that could close in, literally. It's scary. the colon can deform, go through deformities that could make life, bring life to a threatening state. We have diverticuli, which most of them bring about bowel perforations, where people have their bowel busted out, and now the fecal matter that is in the colon now could get out of the colon into the abdominal cavity, when naturally it is supposed to be contained in your large bowel. All of these deformities happens to the colon when we have stool retention or fecal matter staying there for days that we can't poop out of us. It's very risky, very serious, and it kills. So these are deformities of the colon, which if they go through all these deformities, you have to understand that your microbiome is thrown off. And microbiome today, we know, for instance, H. pylori, which for very long days or decades, we've been looking at H. pylori as a cause of ulcer and other bowel disorders. But today we know H. pylori does more than that. In its right state, it's supposed to help regulate our appetite. But if we have fecal impaction and we are backed up, H. pylori normally leaves its job of regulating appetite and goes on there to address fecal impaction by chewing up some of the stuff we cannot poop. It's a lot that goes on to affect us in many levels from our gut. So these are some of the factors that impact our gut health. Alcohol, contraceptive, exotic travel. Someone would ask, how does exotic travel affect gut health? When you are on the go, eating, drinking, changing sleep patterns, due to the places you find yourself, it does affect gut health. With different waters, different food flavors, and different sleep patterns affect gut health. By now, we should know that poor sleep and insomnia is a disorder of the gut, and it's not in the head here. It's in your abdomen. If you can't sleep, it's a disorder in your abdomen, not in your head. All right, so old age, as we know, cesarean form of delivery affect us. Restrictive diet, having to eat one way throughout the week. You can list your food, very limited. Our gut is found to behave like the ground, the soil. You cannot plant one crop on the same piece of land throughout the season. You have to change. So is our gut. It hates one way of eating. You have to eat variety. This is why we were created into garden with variety of fruit and vegetables all around us. So break the habit of eating a very few listed meals and begin to try different meals. Refined sugars affect our gut microbiome. Chemicals, additives, preservatives in the food affect our gut microbiome. And when the microbiome is affected, we know what happens. It affects our growth, our physiology, and a lot, which is in the previous slide. Processed food affect our gut microbiome. Stress, feeling stressed, getting stressed over a job or over whatever that stresses you, moves your cortisol high and low anyhow. It's not good for you. Medicine, antibiotics, as we know today, because of excessive use of antibiotics, we have today what we refer to poop pills and poop transplants. We are now at a point where we have to give certain people that has been exposed to excessive antibiotics poop from healthy humans that have good bacteria in their poop. We are now administering poop from healthy individuals to individuals that lack good gut bacteria in their bowels. We are giving them healthy poop from others as we used to give transplant blood to others. This is where we've got into with antibiotics, damaging all the life in our bowels. And of course, alcohol, I have said that. So these factors are impacting our gut. And how does the gut communicate to us when it is going through stress? How does it communicate with us? Through the changes in our stool, how we would, the pattern in which we pass our stool changes, that's communication from your gut. If you normally go every morning, then you see changes, you begin to go every afternoon, not morning, that's a communication. It's not normal. Don't accept it. The color of the stool, we do have this fact. What we eat, especially fiber-rich, fiber, especially the insoluble fibers, are not digestible. Fibers literally are not digestible. So they are normally seen in our stool, changing the color of our stool. And if you're not on fiber-dense food and you're seeing changes in the color of your stool, such as red or black and other colors that you're not familiar with, check with your physician. Getting checked early is very necessary to prevent any growth that may be happening in your bowels. Rectal bleeding. Rectal bleeding is a communication. Could be, piles or hemorrhoids, as we know, and you need to address that. Hemorrhoids is another word for hemorrhoids is varicose veins of the anus or of the bowels. They are basically veins that are swollen up due to excess compression from a hard stool. Abdominal discomfort is also one of the communication. Your bowel doesn't empty completely. Every time you pass a stool, you feel like if you had sat on for some more minutes, you would have gone more, or you would have eliminated some more. This is communication that your bowel is under stress and it needs help. Abdomen fullness feeling, the little water, drink, food that you ingest, you begin to feel full. When you know yourself, you used to eat more than that. And these days, the little you put in your mouth, you begin to feel full already. This is communication from your bowels going through stress. Fatigue is a bowel communication of I'm going through stress. Weight loss and weight gain. Unexplained weight loss, unexplained weight gain, which you've done whatever you could, and it comes right back. These are communications that your bowels are experiencing stress. Next slide. So enough of the discussion of problems. Now let's look at solutions. How can we attain a healthier bowel? We need to eat more plants, because only in plants could we get variety into our bowels. Give your digestion a break. Don't fall for breakfast, lunch, dinner. That's propaganda. Don't get food. You eat when you are hungry. Don't force yourself into, I must have breakfast. I haven't had my lunch. Oh, I need to eat dinner. No, eat when you are hungry. You could go more, okay? Or you could go less. Don't be following no pattern such as breakfast, lunch, dinner. Eat lots of fiber. Eat lots of fiber. Reduce added sugars. Try to have fruit being your sugar instead of refined sugars, okay? You could have apples serving as sugar for you in the oats bowl instead of adding a refined sugar to it. Eat whole foods. Move from the habit of eating stuff that has gone through extractions. If you isolate anything from the eat whole, you literally looking at a drug. And our digestive system is a sophisticated system designed to do simple tasks, which is to disintegrate whole food and safely absorb what it needs out of them. If you are to give this system, such sophisticated as it is, already work done to do, you stress it, you throw it off balance. You can't continue to eat stuff that is not whole. Your gut, your system is not designed to process foods that are not whole. You're going to break your system, as right there in your mouth, your food lacking fiber, because to process something is to take the fiber off it. And when your alimentary canal or your oral cavity senses what you're chewing doesn't have fiber, you're going to be in trouble. So eat whole food. Don't eat isolated. Get your pre and probiotics. Eating fermented food is also a good way to go in feeding your gut bacteria. Make sure you are having healthy fats or healthy nuts. They go together. We have the similarities of frugivores, and we therefore could break down nuts and seeds better than we could break down meat and fish oils or processed oils. Let's get moving. Let's get moving. Your gut loves it when you're moving. And we would, some of us would be able to tell when you eat certain food and it dawns on you, it keeps dawning on you, causing you to feel full whilst you sit or lay after eating. But when you walk out or go for a walk, you realize that everything has balanced out properly with what you eat that was, feeling down on you. And make sure we are drinking. On the drinking aspect, I always advise my people to make sure that they have come up with a drink that is easy to take a lot of. So you could have a lemonade prepared, and you could be drinking lemonade as water. And because of that, you could drink more. You could have a cereal or any fruit juice at all you like. You could prepare that and, dilute it with water and have it by you and be drinking enough of it. The goal is to take in fluid. The goal is to take in fluid, especially if you found yourself ingesting more dried food. Make sure you are ingesting fluid, and especially when you found yourself in certain temperature zones, that your body gets to lose a lot of water when you are not aware of it. You want to replace those waters because your gut needs water. We saw the video of constipation. If you don't have these fluid in you, your gut will go into your tissues. Mind you, your gut is like a mother of 50 kids or 50 children. It has power to go into your brain to pull water from there to digest your poor water intake habit. It can go into your heart. It can go anywhere in your body to pull water to come down and help digestion. That's the power of your gut. It has power over everywhere in your body. It could go in there and drain that water to come help flush whatever irritation that it's feeling out of each chamber. Just as we see when we take laxatives. Where does those water come from? It comes from your different tissues that your gut pulls this water from to flush out the irritating effect that the laxative is giving it. So make sure you are taking water. It's very necessary. And modify it. It doesn't have to be plain water, which we all don't like to take more of because we are creatures that are designed to eat our water, not to drink our water. That's why we're not good at drinking it. So what can we expect when we heal our gut? These are the few points that we could take note of, that it's serious business to start the healing from your gut, and after, find out what will be left. What will be left after the gut is healed? What will be left to address? Because it's a fact, we get 89% of our 99% issues resolved when we heal our gut first. So make sure you are not wasting money on skin pomade when your colon is not cleansed. Make sure you are not taking allergy tablets and medications when you haven't cleansed your bowels. Make sure you are not taking any pill for brain power and boosting your cognitive skill when you know you haven't cleansed your bowels, because memory loss and forgetfulness is a disorder from your bowels, not from your brain. And as well as being able to have an improved absorption for what we eat to reach their destination, we must make sure our gut is cleansed. Very, very necessary. A lack of sexual desire, libido, these are all symptoms of bowel stress. It's mind-blowing how you take care of your gut and a lot of things you thought you have as issues vanish, because they are issues just branching from different communicative channels from our gut. And when we heal our gut, they vanish. It's like when a mother is okay, the children are okay. That's how it goes. So this is where I would end with this presentation and open up for questions and comments. Thank you.
Amazing session, Dr. Rofeh. So guys, if you have any questions, please just raise your hand and then I'll call on you and you can unmute yourself and ask your questions. Okay, let me see. So raise your hand. You can do that via Zoom and then I'll just call on you and you can ask your question. All right, Jamila, you're up.
Good afternoon, everyone. I'm just wondering if doing the colonic, how does that work? If you're flushing water into the large intestine, isn't the large intestine responsible for absorption of water? So is it possible that you can absorb like pathogens through that treatment?
If I heard your question, you're asking, is it possible to clear pathogens through the treatment?
I was asking if like through flushing water into the large intestine, because the large intestine primarily like absorbs water, can we absorb whatever pathogens might be in the large intestine if we were to do the colonic?
Yes. If you get just one colonic and you don't continue, we have something called reabsorbing your waste back into you, because the first session only rehydrate the contents, and you have to go back in the next 3 days time to hit on the second session to bring what has been rehydrated out of you. If you don't do that, you get the content reabsorbed back into you. So this is why in the industry, we say a minimum of 3 sessions. You can't just go have one session. That's not beneficial. So yes, to your answer, yes, it's possible to get reabsorbed, dried, settled toxins back into you. You just rehydrate them and reabsorb them back.
Okay, thank you.
Awesome, Jamelia. Doctor, I have a question from my end, right? What do you think about natural laxatives like senna and some local herbs that me being an African, I know my parents always give me like herbs. They used to give me herbs when I was growing up. What do you think about that?
Okay, so herbs are helpful, especially when you use them slowly and like everyday life, taking teas with them to gently evacuate your bowels. They are very helpful. However, you need to understand that when a person is not having this as a lifestyle and they are impacted and they want to move their bowels, these herbs are no longer effective for an extreme cases, extreme conditions. These herbs are no longer effective on moving this waste out of the chambers, because if you would bear with me, we all have the experience before where we take in some kind of herbs that's supposed to flush our bowels out, and we normally eliminate or poop a lot of water instead of this actual waste. We tend to go past water, and the reason being that the laxative effect in the herbs irritate the bowel walls, and your bowel just pull water from wherever it could get water from to flush it out. And that is why we tend to visit the washroom few times. And another risk of it is that the bowels become dependent on these herbs and would put you in a state of not sensing the herbs, you fail to go, and it becomes a habit. Without the herbs, you can't poop.
Oh, I see. Okay. Okay, awesome. Thank you. Yvonne, you're up next.
Thank you. Thank you for taking my question. Dr. Biney, I am so excited to hear what you've presented today. I personally was fortunate enough to be able to take advantage of some of your treatments. And one of the things that I would love for you to touch on is the experience of how I don't know how to explain it, but it's not just it's a combination of different things. So as you mentioned, it's not just taking the herbs as was mentioned, but you do a whole routine or a whole system where you have to drink the, what's it called, the Gals K. That loosens up and prepares the system, and then you do the colonics, and then you do the actual diet plan, and then but each and every step is important. So if you could expound on that. Took how many months for me to go through the system?
Yes, I'm excited for you to bring that up. Yes, so on that note, as I said, clinically, the things that we see and the experiences that we go through, I developed a gut cleansing package or program, which takes about 4 weeks to the maximum like 12 weeks. And family, your gut could keep waste from your childhood to date. You can harbor waste from the day you were born. I mean, the day you stop or cease to poop regularly, as I've explained earlier, the day you stop to eliminate exactly the amount of meals you eat. From that day, your gut began to harbor waste for decades. Some of you or some of us, some of people walking around this planet are keeping about waste as same as their age in them. And it doesn't take 1 or 2 colonics or 3 or 4 colonics to bring these waste out. These wastes are part of your bowels. It has taken shape and everything like your bowels and blocking the channel through which your vitamins passes through. And to get this waste out, you know, as Yvonne was saying, I developed this program where you'll be on fruit and soups, prebiotic soups, and I have tissue cleansers formulas which you drink to loosen this waste out. I have clay and different formulas with energy boosters that, you know, it's like a program you will be on for about 4 weeks to the maximum of 12 weeks. And all of it is to get your colon thoroughly cleansed, as we saw in the clip before and after. And the duration was about 3 months to getting the bowel thoroughly clean, just and having the feeling like you bathe. You know how it feels when you haven't bathed for some days versus how when you finally bathe, how the feeling is when you bathe. That is how it feels. You feel very light and very free from within when these old ways get out of you. And I mean, thank you for bringing that up. It's not just on 1 colonic, 2 colonics. No, it's a program. And at my center, I'm bringing some. I'm creating this awareness of us moving from what medication or what therapy, and we thought we could just get 1 or 2 sessions and we are free. No, you have to stay on regenerating that tissue back into its vibrant state that you lost it from. Other than that, mind you, you get to pass on that weak tissue in a form of genetics and hereditary to your generations. So you have to take time to regenerate. It goes more than taking a pill or a therapy 1 session or stuff like that.
Okay, amazing. Millie, you're up next.
Okay, thank you. Dr. Biney, thank you
Yes,
and well
ma'am.
done for this wonderful presentation.
Thank
My
you.
question is, a baby who loses the mother on the day of birth and is fed on artificial baby food throughout, how is this baby's gut life going to be? Is it going to affect the baby in the future life or what? I want to know, please.
Absolutely, absolutely. Just as we viewed the science of us ingesting the right food so that it could be utilized by our system and be stored for smooth growth and regeneration, repair of different tissues that wears out. Same with the baby. You see, when we are babies, at that stage of baby, the perfect source of food that the baby's body could recognize and utilize is the mother's breast milk. And whatever the baby needs, you have to understand that baby's saliva communicates with the mother's breast tip. And the babies utilize their saliva to pull from the mothers what mineral or types of minerals that they are lacking. They communicate it through their saliva, and that is what the mother's body automatically supplies to the baby in a form of breast milk. So it goes beyond just sucking of breast milk. It's a beautiful scientific way of getting the baby's body restored with the minerals the baby needs. So if for some crisis the baby's mother is not there, we could, today the baby could get support here and there to grow and to develop, but that baby cannot be compared, as we know today, with the babies who got well fed or breastfed from their mothers, because the breast milk builds the gut microbiome, and the gut microbiome affects or impacts on growth and development, and how the baby will respond to stress and the environment. Everything are built within the gut, because the human body is outnumbered. The bacteria outnumbers our cells. So if you don't get these blessings from the sources as nature had designed it, you will grow, but you will be lacking essential minerals, and that could affect you and your generation if you happen to be the baby from such a mother. You have to live with proper knowledge to feed on what you lack, else you'll be prone to diseases. That's another point.
Okay, thank you, Doctor.
You're welcome, ma'am.
Amazing. So Ray, you're up next.
Hey there, Dr. Rofeh. Thank you for that presentation.
You're welcome, my brother.
Kind of have two questions, actually.
Yes.
So the first one is, I think you alluded to it earlier about kind of flushing the system with a laxative. Like I used Epsom salt last night and it worked very well. Does that help clean the gut?
Oh, yes. It does help cleanse the gut. And they are all helpful. These are all helpful. And I must get us to get the picture clear or see the picture clearer on the side of increasing fiber, okay? Increasing fiber. Using Epsom salt is good. Using herbs is good, but you don't want to be dependent on these.
Okay, thank you.
Yes.
And the second one is, over the last few years, I've started to get some like white spots on my skin. And I haven't been taking care of I don't eat a lot of vegetables. I eat a lot of refined sugars and things. And I'm wondering if that's the cause, the gut.
Yes, yes. White patches are communications of different deficiencies that's going on in your body, such as magnesium deficiency, and you can see that through you not being able to move your bowels on timely manner. And we have areas of excess breaches of excess bruises in the mucous membrane in your gut. When it becomes too tender, those areas those areas in your gut that are too tender begins to share through their corresponding tissues, the white patches. It appears on the skin, white patches from the areas that in the gut that are heavily being bruised and heavily lacking these essential minerals. So your bowels, as I said, colon is about 6 feet, small intestine about 24 feet. So your 30 feet bowels, if it's lacking these essential minerals, and if it's being bruised excessively over fiberless food that you ingest, these areas that will be bruised will be exposed to these white patches, and your bowels are grouped into from the area where you have your appendix. You could imagine that area being your head, the area where you have the appendix. You could imagine that being your head, and your anus being your foot. anus being your fourth. Now, if you divide it up, where you have the patches, these white patches at most, is where you have in your gut lacking these essential minerals and also being bruised excessively and is feeling, looking tender. And these and many other reasons brings about the white patches. Our bowels is a reflection of our skin and vice versa. Our skin is a reflection of our bowels. So if you wrinkle, if you see yourself wrinkling, it's not always age, because your bowels, you could abuse your bowels and it could cause you to wrinkle earlier than you should with age.
Okay, thank you so much. My wife has a quick question for you. That's okay. She's asking, could a C-section affect her gut? If so, how?
Okay, so C-section, you have to understand they go into the abdomen, and oftentimes a person could actually have their gut impaired or affected. And in the name of getting the baby out, that whole incidence of cutting through the abdomen affects gut bacteria. Babies, most importantly, we look at it from the baby's side, where a baby would have to be picked from the abdomen that is open instead of the vaginal canal, because oftentimes nature had designed it that mothers need to poop during the time babies are coming, and they get to expose babies to various microbiome or gut bacteria or bacteria that actually contribute to the baby's gut bacteria, multiplication, where they get to multiply their gut bacteria through the skin. See, babies have open pores all over, and they get to have this poop mixed with them. So C-section affects more of babies that are coming through that channel and not through the vaginal canal, than more so affecting the mothers. The mothers sometimes get injuries or get mishandled, and that's how they affect the bowels in the abdominal cavity. But it does affect babies picked from that approach than compared to babies that come through the vaginal canal.
Thank you, sir.
You're welcome.
Great. Nikisha, you're up next.
Okay, thank you so much. I just have a quick 3 parts. First part is the system. Is it remote, the system that you have produced? Can it be something that we can do remotely from anywhere in the world?
Yes, it can be done anywhere in the world. When I'm able to get you these formulas to take and to get you the diet plan to follow, and it would only be the crisis of unavailability of fruits at where you are. But if there is fruit, then yes, you can go through it and cleanse your gut where you are. Now, these formulas that I have doesn't only cleanse the colon or the small intestine, it does clean the digestive system. So we're looking at every tissue that makes up the digestive system. It cleans the colon and the small intestine. It cleans the liver, pancreas, gallbladder, the spleen. It cleans a lot. And it gets you feeling brand new to start over in a correct manner. And
Appreciate
yes,
that.
we can get you somewhere you are. However, it normally so far has been getting it through somebody coming your way so far because of the makeup of it. A lot of shipping companies reject being a frozen formula. They reject sending it through flight. Companies reject it. So normally we get it through someone coming that way and you could get it. But if you're in Africa and nearby countries in West Africa, we could get it to you. That is not a problem. But if you're at overseas, we're going to have to get it through someone coming to you. But if you get these formulas, you could actually press the reset button and get your body into a youthful, thriving state again.
Great.
Okay, thank you so much. I just had another quick question with regards to fruits. Is frozen fruits okay? Like we have a magic bullet, and I found that I started getting the frozen fruits, and I would blend it up and eat it like a sherbet. Just eat it, add nothing to it. I think I add a little bit of flaxseed and I just eat it. And then I started noticing my body craving it now. So is frozen fruits okay if, fruits are not as affordable or accessible to get?
Yes, ma'am. Frozen fruit is okay. It's better than not having fruit at all. And if they are, with seeds, then and frozen, they are much than okay, and they're better than genetically modified. So
Okay,
yes.
yes, thank you. Because what I started doing as well with the sherbet, and I plan to get some more of that, is that lately people have been saying don't discard the papaya seeds, but I noticed that if you can't get fresh papaya or papaya seeds, you can get it dried powder. So as long as it's organic, can I then add something like that? I add, instead of drinking the sorrel tea, sometimes I'll break the sorrel bag and use that in the sherbet as well, and then cinnamon and things like that. So is that okay to do? It's not going to overwork the system.
I would say it's okay for now since you've done it in the past, but I would advise you that do not combine more than 3 fruits. And fruit is actually medicine. We normally think that medicine is what we pick from the drugstore, but you could get fruit to throw you off, and especially papaya seeds is potent. The seeds of every fruit is where the powerhouse is stored. You don't want to play with them. Make sure that you're taking them in small doses for whatever hearsay you are using it for, and make sure that you could actually reach me out after this presentation to help you out with the food combination. There is a way you combine fruits, okay? Over here at my center, we help diabetics to come off medication. And before that, they would be, most of them would be complaining that my doctor had taken me off fruit. I'm told not to touch fruit. And I would tell them that's not true. It's the way we eat fruit. See, we could hardly sit in front of 2 pineapples, cut and eat them. We could hardly sit in front of 2 pineapples to eat, but we could go on and drink more than 2 pineapple juices. You know how it goes.
Yes.
If you can't eat 2 pineapples, how would you drink more than 2 pineapple juices? at a go within some few minutes. So this is how fruit is, and this goes back to eating stuff that are isolated. You want to have them.
The drinking is easier. The drinking is easier and sweet.
Yes, the drinking is easier, but you have to measure it with what you can't eat. If you can't have more than 3 oranges, do not take a juice from more than 3 oranges. That's a load, because she did mention of the load, overworking the system. This is how we overwork the system. And another thing is all the fruits carry different chemistries. So you don't want to have watermelon, pineapples, mangoes, all in your bullets and you blend over. No. Watermelon has a different chemistry. It communicates and instructs your body differently. How would you expect it to instruct your body when you've mixed it with oranges or pineapples or pawpaw, papaya, when every one of them have a way of instructing the body on what to do? So monodieting, when it comes to fruit, you want to eat them one at a time. It's best to have your watermelon, and afterward, about an hour, you can have your pineapples, or after some half an hour, you could have your mangoes. You don't want to have them all on the same plate. As I mentioned earlier, breakfast, lunch, dinner is a paid lie concept. So as fruit salad. There is nothing like fruit salad. If you follow this, you're going to throw off your body's chemistry, and without proper knowledge of your faulty action, you're going to be standing somewhere telling someone that don't eat fruit and don't touch that fruit. And when you do it, if you're diabetic, it's going to spike your glucose level, and it's going to do you this, it's going to do you that. We don't talk about how we ingest them. We don't talk about the faulty combinations. We don't talk about the load. Drinking what we can't naturally sit in front to eat. So you want to be very, very simple, with the fruit, because this is the main food for your system. None of the things we've been eating today is the food. They don't even instruct our body. None of the things we are eating instruct our body. It's rather shut our body down. Our body gets shut down on them. It doesn't instruct the body. The body gets shut down on them. But fruit instructs your body. You could eat melons like watermelon, and you could your sexual desire could rise up. That is instruction. You can eat ginger, you could eat papaya, and you get your bowels to move. So fruit is the actual food that instructs the body, tells the body what to do, which the body responds to. Any other stuff, the body shut down on it, on them. So let's take note of that.
Thank you so much, Doctor. Just the last one real quick. Parasites. So sometimes naturopaths say that, oh, the reason why you're having gut systematic issues is due to being full of parasitic entities in your body, and you need to flush out the parasites. So that's part in why I brought up the papaya seeds, because sometimes, whatever is new out there, people will start sharing information all over the place. Oh, take this, take that, take this, and then not really take time, like you said, to look at the chemistry and how it breaks down in your system, and you can actually do more damage. So my question to you is, real quickly, regards to that, is once we take care of our gut health, does that also take care of the parasites, just like the bacteria? We need some of them instead of trying to get rid of all of them. So even at the microscopic levels.
Yes. When you see the colon is our body's sewage system. Okay, the colon is our body's sewage system. You don't want it to turn into a cesspool, because it's only when it has turned into a cesspool that parasite survives. Because parasite comes in the form of egg or in the form of a baby, because literally we cannot see them. That's why we ingest them. And normally it comes from the meat, which could harbor parasites, just as collected waters can harbor mosquito eggs or parasite and breed them later on. Same as the meat and these different animal proteins and dairy could harbor the parasite eggs and release them in our gut. And if you are on this food that shut down your gut, then you don't get to flush these parasite out of you because the eggs get in there, hatch, begin to grow and develop. And if you are taking care of your gut flushes them out naturally with your poop. Your stool brings them out. But if you are not bringing, if your system has changed into a cesspool, you give them the environment to grow and to go through different areas in your body to mess you up. So the goal has so far been getting your bowels moving. The rest, you don't have to think of it. And in that goal, we see eating more plants to be the solution and cutting down on animal flesh like meat, dairy, and what have you. Because the science is clear. When you eat food that doesn't contain fiber, it goes to stay and breed parasite. And if you have more plant going in you, bringing the waste out, then you are good to go on harboring parasite. You don't have to even have that as part of your burden when you're taking care of your gut.
So it will be a natural part of the system, just like bacteria and probiotics and things like that. Thank you for clarifying that. Thank you so much.
Correct. You're welcome.
Amazing. There's a user here, Zoom user. Kindly identify yourself and then you can ask your question.
Is that me?
Yes, I believe it is.
Okay.
Yeah.
Oh, good evening. I'm sorry, I came in late and I missed a lot of it. My question to you is, well, thank you first of all for the presentation. It's really useful. My question is that I'm already diagnosed with colon cancer, and I was listening to the your treatment thing, but you're saying that you're in Ghana and I'm in the UK, so I don't know how I would get to start the treatment, or is there any way I can contact you where, you know, the stuff you can let me know what to do here? Because like I said, I'm already diagnosed with it. They want to do the surgery, but if I can do things in advance to prepare it or to make it lesser, or I don't know, I'm kind of overwhelmed with it, with the diagnosis. So yeah, I've got colon, they say it's colon cancer stage 2.
Okay.
So how can I get in touch with you to start working on doing what I can now?
Sure. Definitely. So let's exchange contacts, get my contact details, and let me see how I could help you from a distance, okay?
Okay.
So that, but immediately drop all dairy, drop all animal foods.
Okay.
Drop all the flour-based food.
Okay.
You know, these are the major cause of bowel cancers. And
okay,
I tell you something, out of the tissues we have in our body, our bowel is one of the fastest tissue to regenerate, the fastest tissue to grow back and to get itself out of any stress when we create for it the environment it needs to regenerate. I mean, it takes a long time for a kidney to regenerate. It takes a long time for liver to regenerate, but the bowel is so fast. The bowel is so fast that you could literally get it turned around faster than any tissue in the body. But
yeah, I think my kidneys, I'm sorry to interrupt, my kidneys are also in a little bit of stress as well because I've got what they say is called nephrotic syndrome, and my legs swells up an awful lot. It just so swollen sometimes that I think it's gonna pop. So, so I've got
you know
those
what?
two issues.
My website is put in the link. You know, hit the website button and reach out to me after this presentation. Let me take time to consult you. I do consultation to international clients, and we see the way forward. When it's UK, your chances of getting help is far better compared to other parts of the world, because we have a lot of clientele from UK coming, going, taking a wellness vacation. We have rooms available. They come and lodge here to go through treatment. So we do have a very easy connection with Ghana, UK. So I should be able to send you package to UK. So
I don't see where I can get. I'm not a techie person. I'm 67 and I'm not good at this. So I'm trying to see where I can get into the chat to see where they've put your website. I don't see it.
No worries. Yvonne could send the my informations to you, since you're a member of the Pamoja. You will get my information from the members.
I don't know, Yvonne. So Yvonne, are you there?
Can you just tell me? Okay, you know what? I can send you a message to get your number, and I'll just forward. I'll forward doctor's number to you as well.
Okay.
Yeah.
So you want me to give you my number now? Is that what you're saying?
If you can,
yes,
I'll
I
just
can.
write it. Yeah.
07 53 922 1812, and it's Maltica, Maltica.
Okay, so it's 0753 922 1812.
Yes.
Okay, amazing. So I'll send doctor's number to you as well.
Thank you. And you are, sorry, what's your name?
Akeem.
Thank you, Akeem. Thank you very much.
Oh, not a problem.
And thank you, Dr. Biney. Thank you.
You're welcome, ma'am.
Okay.
Awesome. Mr. Patrick, you're up next. Mr. Patrick, are you available right now? Hello? We can't
He
hear
said
you.
he's talking. Mr. Patrick, try again. It's breaking up, Mr. Patrick.
Maybe his network is bad. So for the time being, we can move to Semra.
Hi, greetings.
Yeah.
Greetings.
Hi, doctor. Thank you so much for this really amazing information.
You're welcome.
Also, I was wondering too, how could I get your product? But then I guess I can get it from Sister Yvonne.
Yes.
So I myself, I have been taking some colon cleanse product from last week Saturday, along with some other stuff too for cleansing. But I noticed from I've been taking it last week Saturday until now, I thought I should be having bowel movements, but I noticed I haven't been having regular bowel movement like I normally have. I went ahead and I did, I took some Senna pads, laxative on Friday. And I didn't have a large bowel movement like I normally do when I take the Senna pad. So I don't know what's your take on that? What do you think I'm not doing?
You probably
Or what should I do?
You're probably not having enough fiber.
Okay.
And you're probably still having something on the plate that shut down the bowel trying to move. Okay, you can't have senna or any herbs that you know is good for cleansing and then turn around to have something like pasta on the plate, or turn around to have some rice after having the herb. So what I'm saying is it's a program. See, and it's difficult to solve this without any assistance. And this is why, we created this program, and we have these wellness vacations that we do in a way of resetting the place and maintaining it from going down the drain again, because it's a holistic thing to do. If you look at it one side, you become frustrated. So you cannot have wrong something on the plate and expect the herb to do some magic. So like on our program, we cater for you only fiber-dense stuff from the fruits and veggies and the different prebiotic tubes and the tissue cleansers and colon hydrotherapy, which brings out what has loosened in you. And our colon hydrotherapy, people do it even up to 20 sessions because it's not a joke. Trying to get your colon cleansed is not one-time shot you take. It's a holistic effort that require much, discipline. And you have to have the proper knowledge.
Okay. So I do not do rice or pasta, but I was listening to you earlier, and I think it might be water. I don't think I'm taking enough water. So probably that would be the case. Do you offer that? Do you have an office? You don't have an office here in Canada, right?
No, I don't have office in Canada.
Okay. Okay. Oh, okay. Thank you so much.
But you could actually book a consultation, so I could go in with you in details to point out what you could do from there, from everything that you've tried. How do you get some success out of it all?
Okay. I was just thinking of the colonic, as you mentioned earlier, like, where could I get?
Yes, colonic is helpful.
Yeah. Okay. Thank you so much, Doc.
You're welcome.
Okay, amazing. Jackie, you have up next. Jackie, are you still? No? Mr. Patrick, do you still have your question or no? Okay, Ray, you have another question?
Yeah, one more.
Okay, sure.
Is there a point where... Oh, someone's...
Oh, Mr. Patrick. So, Mr. Patrick, are you can you speak now or?
No.
Ray, you can.
He wrote no. I think there's something wrong with his mic.
Okay. Ray, you can proceed.
I just
We'll
wondering
look at the chat in a few minutes just to see. You can type your question in the chat and then we'll go over it.
Yeah.
Ray, proceed. Thanks.
Is there a point, could the gut always be healed? Is there a point where the gut is too far gone to be healed?
Yes, there are points the gut are too far gone to be healed. Instances such as stage 4 colon cancers and nearly life-threatening. These are way too far. The person, it could be reached, but the person can't go through the pain and the discomfort. So we term it as too far. However, the immediate start of immediately a person stops ingesting what stresses the gut, all bowel distress right there begins to turn around.
Okay. Thank you for that. I'm also interested in your program. Where would I find the details?
On our website.
Oh, speakers on.
Hello?
It's God Care in Ghana. So I'll send the link out with the website.
Thank you, Akin.
Okay, great. Jackie, you're back on. Ray, that is everything, right? You still have more questions, or that's it?
No, that's it. Thanks.
Okay, awesome. Jackie, you're up next. You have to unmute yourself. We can't hear you. Oh. Yvonne?
Hi, Akeem. It sounds like it sounds like we need to have another trip to Ghana.
Yes, I'm telling you, absolutely.
Just to go, just for and maybe we'll make this one a health retreat trip.
Yes.
But yeah, no, I'm very happy with the type of questions that we're getting, and I'm excited that, you know, as a community we are, you know, so very much interested in doing better and taking better care of our health, and that's the whole purpose of Pamoja bringing this session to everyone. And I just want to, you know, put a plug in there that, you know, look out for our other sessions that will be coming on a monthly basis, all there to help you develop, grow, improve, and live better, healthier lives. So I just wanted to put that plug in there before we end the call.
Amazing.
This
Thank
is
you, Yvonne.
Jackie. Can you hear me?
Yeah, we can hear you now.
Okay, hi. I'm not a techo girl, you know, it takes me a while. Hi, Doc, how are you?
I'm well, how are you?
I'm good, I'm good. I am also calling from Canada, and I know we have a lot of Africans in Toronto.
Okay.
Do you have any contact with any of the Africans in Toronto that could service our needs?
Not at the moment.
Okay. I also got in late into your Zoom session. The gentleman that took the number, is it possible I can give him my number and he could reach out to me?
Yes, you could do same.
Okay, are you there, sir?
I am, yes.
Okay, so my number is 1-647-704-6927.
Okay, great. So I have 647-704-6927.
Yeah, is it possible to get your number?
Sure, totally. My number is 647.
Are you from Toronto?
Yes.
Okay. Okay, go on.
647-660-3140.
660-3410.
3140.
3140. Yeah, and your name?
Akin.
Spell for me.
Akin.
Where in Toronto are you?
Well, I'm in Africa right now, but
Okay,
yes.
I'm from Scarborough. Are you familiar with Scarborough?
Totally, yes. We have contacts in Scarborough. We have members in Scarborough, so you'll be fine.
Okay. Okay. Okay, thank you.
Okay, not a problem.
Bye-bye.
And sis, I just wanted to state this. I think it was Jackie that was speaking just now from Scarborough.
Yes.
The organization that is hosting this event is called Pamoja. We've just posted our website link. It's pcif.ca. You can always reach any one of any one of us by going to the website. Also, if you want to send us an email, it's info@pcif.ca. And you could check there. We have a Pamoja Farms project, and there's a number of different projects that we have running under the organization. And if you're in Scarborough, I'm also in Scarborough. I live in Ghana as well. And Akin is in Nigeria, live in Scarborough as well. So you have a good connection through Pamoja.
So when are you coming back to Toronto?
I'm here right now. I'm in Toronto right now.
Okay,
I'm
so
in Scarborough.
please give me your number also so I can call you.
It's 647
Mm-hmm.
248
Mm-hmm.
2481.
2481 647 248 2481.
Yes.
And your name is?
It's Yvonne.
Okay, Yvonne. Where in Scarborough you live?
Markham and Ellesmere.
Oh, we're neighbors.
Ah.
Okay, I'll definitely be linking up. I'll be linking up with you. Okay.
Perfect. And anyone else on the call, if you are interested in what it is that we're doing, Pamoja is a group economics social enterprise, a cooperative registered. If you're interested in some of the things that we're doing over the summer, if you're interested in coming out and doing some farming, if you're interested in participating in our farm, in our land share projects, and Akeem, I'm sure you'll talk more about that before we close off. Reach out to us. We are doing some amazing work, and I just want to thank you all for joining the session. We have a lot more of these sessions to come, so stay tuned and stay in touch.
Okay, thank you. Thank you so much.
Great, awesome. So we have what else? Okay, so there's Jackie, comment section. So Yvonne, I'm not sure if there are any questions in the comment section, if you can.
Sorry, I went off mute. Is this group in Ghana? Pamoja is, well, Akin, the question is this group in Ghana?
So we're a Canadian group. Basically, we're just a group of Black Canadians that came together that decided to pull our resources together and invest. So the very first project we embarked on was 100 acres of organic farmland we purchased in Kowata Lakes. Yvonne mentioned earlier, we have opportunities for for you to be a co-owner of the land as well with our new offerings. So with about 1,800 for the year, you can co-own the property with other Pamoja members. You get access to about 400 square foot of land space to grow your own organic vegetable. And in addition to that, you partake from any revenue that we generate from the farm. So we are a Canadian group registered with the Canadian government. We visited Ghana as a group just to trace our roots and to learn about African history and and so on and so forth. And we're definitely planning to visit other African countries as well. Yeah, so we want to continue to grow the organization, but the goal of the organization still remains the same, which is economic growth for us as a people. Because if you look at the dynamics of how things are in Canada, particularly, we are mostly consumers and we don't produce anything, we don't own anything. So we're working to change that narrative. as a people. So starting with the land, which is 100 acres of land we acquired, we have a goal to be mortgage free by the end of this year. So we're working towards that. And that's what we're all about. We're about community building, working together, growing together. We have different workshops that we've planned throughout this year. This one being the first. We are fortunate enough to have the doctor back again, because the first session was actually in January, but so we had to bring him back again because he was too good for just one session. So
Please, where is the land located? In Ghana?
no, our land is in Canada, in Coata Lakes, Ontario. So it's about an hour, 30 minutes from Toronto. So it's 100 acres of land. Let me see if I can show. There's a video here that we have of the land when we purchased land. Let me see if I can show you guys the video. Give me 1 minute. Can everyone see the video?
Yes.
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 Great. I just play it.
Hello, everyone. Thank you for joining us. We are Pamoja Community Investment Fund Development Cooperative, otherwise known as PCIF Development Cooperative. Who we are is a group of African descendants living here in Canada who are dedicated to the forward movement of our people, to ownership, and specifically collective ownership, group economics, and unity.
So guys, we're here together today in the Woodville area in Kawartha Lakes. And this came together just about a year ago when we sought the opportunity to purchase land together. And here we are, having made our first purchase, many more to follow. Let's get a cheer. Woo!
All right, you can check out the video on our website. So it's pcif.ca. And we also have Pamoja Farms website as well, pamojafarms.ca. With Pamoja Farms last year, we were able to, grow and sell vegetables. So garlic, callaloo, and spinach. Some vegetables we were able to sell in our vegetable harvest box directly to consumers. And this year we have plans to grow throughout the year. So lots of exciting things that are definitely coming up that we're planning for this year. If you want to become a member, you can sign up, just with $150 on a monthly basis, monthly commitment for 12 months, or just a one-time fee of $1,800. You can become a part owner, a co-owner of our 100 acres farmland, meaning you benefit from any revenue we generate on the farm. If the farm makes money, you make money too. In addition to that, you get 400 square feet of land that you can grow your own vegetable for your household. Our goal is to raise about 900,000 by December of this year, so we can completely eliminate our mortgage. So we will own the land outright and we'll be mortgage free. So that is our goal for the year. So you can also sign up on the website, right? Any questions? Questions, comments?
I'm also living in North.
You're also what? Sorry?
Oh, I didn't have my mic plugged in. I also live in North Kawartha. I live, I think, a little north of you guys. I'm in Woodview. You guys are in Woodville.
Wow.
So when I saw this group, I haven't actually, like, I'm a member on WhatsApp, but I am going to invest in this group with me and my wife. So it's exciting. Was this group created for because of the food insecurities, and how do you think the cost of food will affect the sales or the production of this stuff?
Wow. Really, really good question. Not food security is definitely an issue that we're really, passionate about and we want to tackle. because as a community, we depend on others for our food, right? Food sovereignty is also a big issue. Like we don't control our food sources or anything like that. So we depend on others again for our food, right? So other than inflation, which is affecting everyone, worldwide, we feel we should be in control of at least our food, especially the cultural foods that we consume on a daily basis. For instance, in the Caribbeans, they love callaloo, for instance. We have to depend on the Chinese to import callaloo before we we can buy callaloo from the Chinese community. It's troubling, right? And if there's any crisis in the world or food shortage or anything like that, we feel that we want to be in a position to be able to at least feed our own community members. So definitely, it's an issue that we want to tackle, and we're passionate about solving some of those issues. In addition to that, we want to make sure that we can generate revenue, we can control at least the market, because the black dollar circulates within our community in just 3 hours, and after that it goes back out to other communities. Again, that is another troubling stat, because we want to be able to keep our money within our community. Imagine going to like some of the popular grocery stores that you shop at, like No Frills, Fortinos, Loblaws, and you see vegetables that are packaged from Pamoja farms. When you purchase those vegetables, you're basically putting the money back into your own pocket, because you own Pamoja farms. So some of the vegetables that you purchase that are from Pamoja farms puts that money back into the community, puts that money back into your pocket. So our goal will be to have a commercial farm where we can grow vegetables and sell to the general public. In addition to that, we want to grow, we want our members to grow vegetables for their own consumption as well. So yeah, it's the two-edged sword. So we're hoping to tackle both issues.
I love it. Thank you.
Yeah. Any additional comments? Oh, sorry, go on.
No, I like what you mentioned earlier, that you plan on putting up greenhouses to grow in the winter as well. That's I
Yes.
think that's important.
Yes.
Just because, we depend on summer for our organic, our organic foods. We don't, in the winter, we don't want to rely on our produce from Bill Gates, because he's growing his own stuff for us. So
Yeah.
I really want to invest in this farming.
And from proper research, we have a farming committee actually, and we found out that, a lot of the vegetables that we consume, that we purchase now, they're just like maybe 10% organic or 1% organic. They're not 100% organic food. As long as you cross a certain threshold, and you use like, maybe organic fertilizers or something like that, they give you the organic mark, like you're organic, but it's not really organic, because the soil that you're using, you can use chemicals on the soil, but as long as the seeds are organic, then you're organic. Like the definitions of what it means to be organic now keeps changing. If it's 1% organic, then it's deemed organic, things like that. But with Pamoja farms, we know for a fact that what you're getting is 100% organic, right? That too. No seedless fruits with Pamoja farms.
That's good.
Yes.
That's great.
All right.
And this ties, and it came real quickly, this ties back into why we have to control that, to control our gut health, right?
That's
so
it.
that we know what's going into our system from the seed to right through.
Awesome. Okay, great. So because of our time, I just want to use this opportunity to thank the doctor for joining us today. Doctor, I'm not sure if you're still here. No? You dropped off?
I'm here.
Oh, okay, great. Okay, awesome. Thank you so much. Honestly, I can't thank you enough. Really, great session and great information. Everything you shared so far. Man, my notes, man, I kept writing notes. Eat your water. never heard that before. But I know what you mean. Like, 80% of the food we consume should be like water, pretty much, like vegetables that have water in them, right? Just
Correct.
taking notes, like I'm just going over my notes again, like lots of stuff here. Man, amazing, amazing, amazing information. We are what we eat. We are a direct reflection of our bowel health. Oh man, my notes, man, my brain is like just going today. And living in Canada for like over 20 years and just you eat burgers and you eat processed stuff. Man, and I'm someone, I love fried stuff. I love fried plantain, fried meat. Oh man, you said no fried food, so I have to work on that. But watching those
Yes.
videos that you played earlier, man, I don't
Good,
want
or
to
is
eat.
that no good at all as well?
Sorry?
Is air frying good, or is that no good at all?
Well, air frying is better than actual frying with oil. Except that, you want to monitor it and trash it when it begins to wear out. You don't want to get the chemicals getting into your food when it begins to fade out.
Okay.
You don't want the non-stick substance coming on your food. So when it begins to wear out, you have to trash it. But for the fact of giving you the feeling of a fried food when you don't have it dip in oil, that's great, at least to get you to come off fried oily stuff.
Okay, awesome. So, Doctor, thank you so much for your time. Yvonne, I think you want to just say a few words and close the session.
Yeah, I noticed someone said little by little, and absolutely. I just wanted to reiterate, there is so much food miscommunication out there. There's so much bad information out there about what we shouldn't eat, what we should not consume, and then on top of it, it's just information overload. So it's just taking the first step, taking it little by little, and making one change at a time is hopefully the message you get from today. It's just like a little baby, you don't give baby hard food, you give baby soft food, and you grow little by little. So don't go away from this feeling overwhelmed and throwing out everything in your pantry, but making the change small, as they say in Ghana. Small.
Amazing. So thank you, Doctor. Thank you all for joining. Really, really great session. Till next time. And if you're interested in becoming a member of Pamoja, if you're not a member yet, you can send an email to info@pcif.ca. I'll put it in the chat also. And you can also visit our website, www.pcif.ca. And you can be a member from anywhere in the world, right? We have a WhatsApp group. We have a membership portal on our website that you can join and become a member. I mean, we have a lot of stuff, lots of exciting things coming up. Other workshops, other, great business opportunities, and we've traveled together as a group. There's so many other exciting things coming. All right. So take care, guys. All the best.
Blessings.
Thank you.
Bye. Blessings.
Bye. Thank you so much.
Thank you.
Okay.